Once again, we're back again with continuing moments in Black history. I tell you, 2022, and my colleague, Dr. Danley, how are you?
All right, to our listening audience, this is so amazing. Today we have with us Dr. LaBraile McCoy. So we're going to allow her to give us just a brief introduction. Tell us about you.
Okay. So I am Dr. LaBraile McCoy. I am a family nurse practitioner, doctorate prepared nurse. And so I started in 2008 when I first graduated with my associates, and then kind of went on and got the associates bridged to the bachelor's. But then when I was working in the hospital, I saw other nurse practitioners, you know, doing their thing, and I'm like, I want to do what they doing, you know. And so I went back, talked to my mom at the time, and she was like, go for it, you know. And so I just kind of went into nurse practitioner, got the master's, didn't stop there.
Wow.
I went ahead and just got the doctorate. And so that's kind of where I am now.
Okay.
As far as that, I have a background of med-surg, psychiatric care. I did that for 3 years, worked for the state of Illinois before I came and moved down here to Georgia. And so I've been here 6 years now. And so just kind of been trying to put my foot in the ground.
Okay, great. And you actually work right here in the city of Douglasville, correct?
I do. So
yes.
I recently just started back working in Douglasville. At first I was over in the West End for about 4.5 years, worked downtown. And so different coming from back there, but I'm glad to be closer to home, back closer to family.
Well, we're so glad to have you here.
Welcome again, Dr. McCoy, and it's amazing. And you said, what inspired you to go into medicine after, did you go to HBCU or?
Nope. So I'm from Illinois, so.
East St. Louis?
Around East St. Louis, not that far.
I know
so most of
my
my family is in St. Louis and East St. Louis.
You know my friend, they got the funeral home up there, Carl in East St. Louis.
And so how I got into it is I had actually moved down to Tennessee for a little while, and down there, in order to go into the healthcare, even though you would have had the experience of working in healthcare or working with somebody like in a nursing home or anything, you had to be certified as a CNA. Oh. And so I'm like, well, that sucks, because I'm like, I've already been doing this since I was like 18. I took care of disabled people for a while. And so when I came back up, I told my mom, I said, Mom, you know, I went down there, I couldn't find a job, couldn't do this. They didn't want you, because if you weren't certified for a CNA. So I'm like, I'm gonna go to school for be a CNA,
go
you
for
know.
it.
And my mom was like, well, why stop there? She said, you ain't dumber than nobody else around here. I'm like, now wait a minute, I don't know if that's a compliment. Like, how do I really take this? But you had to know my mom to understand her. But I knew what she was saying. In other words, if somebody else can do it, you can do it. So I started looking into the healthcare field, and I actually started at RN. She tried to get me to do LPN, but as I did more research, just the rewards of being upper level, you know, just seemed like it was more for me. Okay. And so that's kind of how I got into it there, and it just kind of went from there. And evolved.
Great. So as an African-American physician assistant, what would you say to our African-American young ladies who are considering becoming a physician in the world today?
Well, it's nurse practitioner.
Nurse practitioner.
So I can't talk to physician assistant, but I could talk to you from nurse practitioner standpoint.
I'm sorry.
So I encourage any lady, guys, even, just if your passion is to be in healthcare and you want to be anything but, you know, like some people don't want to be an MD. Some people want to be in that nurse setting. And so I encourage anyone to go for it. Like it's a tough ride. You have to be definitely dedicated. It has to be something that you want to do. You know, you can't be like, oh, I'm just in it for the money, or I'm just in it because I know I can have a job, or I know I got job security. That's not going to work. You have to have a passion for it. They're going to work you. They're going to try you. You got to make sure you study. No social life. None.
For how long?
Are you serious? No,
I
what?
gave up a lot. I gave up a lot to get to where I am. It was points of time where, like, my mom, she would want us to go travel to St. Louis to go to, like, birthdays or Easter. And I would tell my husband, no, you take her, you know, take the kids, you go, I have to study. So I missed out on a lot of birthdays. I missed out on a lot of family time, a lot of different things just to make sure that I pushed through and made it through. But anybody can do it if they, you know, just put your all into it. Just know that it's a sacrifice.
So how many years? Just from the beginning?
So for me, for my associates, it took 4 years, just because I had a family And so I had to, you know, balance that work, family life, and school life too. And so I was working full time, actually 2 jobs. And so I was going to school full time, working 2 jobs full time, and teaching fitness and stuff on the side.
You go,
Teaching
girl.
So I was, yes, I was teaching fitness and stuff on the side. And so it took me, I split that up. I did all my prereqs first. So that way I didn't have any distractions in the actual nursing part. That way I could just focus on just the nursing. So a lot of times when people ask me, I tell them, do all your prereqs first. Then that way you can focus on the nursing. Then I did the 1-year bridge to the bachelor's.
So we're looking at 5, is that 5
so now
years
this is
or
5.
6? 5 years, okay.
But if you go straight into the bachelor's and skip out of the associates, then you can potentially save that year.
Oh, okay.
So I kind of added an extra time to me.
Right.
And then, so then that was the year to the bridge, and then it took me 2 years to do my master's because I did it accelerated. I actually convinced the advisor at that time to let me do my clinical sooner. She was like, well, if you pass, I said, don't worry about that. I'm a pass. I said, you just get me in that class. And she got me in, so I was able to finish up in 2 years with my MSN versus, and then my doctorate, that took me 2 years.
Wow.
And so I went through, and that was all online. That's more of policy, procedure, legislation, things like that.
Whew.
Exhale.
So, yes.
It was a road.
Wow. So as a nurse practitioner, what are the disparities in health have you observed and experienced as an African American provider?
So I've noticed the biggest thing in our community, literally the biggest, is blood pressure, hypertension, cardiac disease. And it's also actually the leading cause of death in African Americans and more so in women. And so a lot of times we find that people come in and they don't know that their blood pressures are high. A lot of times people don't have the feeling. Some people experience headaches, dizziness, different things like that, and some people don't experience anything at all.
That's scary.
And so that's the scary part, and that's why they call it the silent killer, because people honestly don't know. And then they'll come in thinking, oh, I'm just here for a med refill, or I'm here just for, you know, a checkup, and then you check them, and then their blood pressure is like heart attack over stroke, you know, so, and it's like, they have no idea. They're like, but I feel fine. I'm like, yeah, but your blood pressure don't say you're fine, you know? And so just that disparity alone, if we could just get a handle a lot, just as Black people, for blood pressure, a lot of times our diets, we don't exercise. We have high sodium diets. We don't drink enough water. You know, we have Popeyes with the, you know, the chicken, and most of the people, I'm like, what do you eat? Oh, I eat Popeyes, or I eat this. And I'm like, do you know that's loaded in salt? Or they do a lot of processed foods, so which is high in sodium. And so I do a lot of education, like as far as teaching them what to eat, what not to eat, exercise, and just getting healthy, just the different ways to get that blood pressure down. But that's a big one. A lot of our population, another thing I notice is denial. They don't want to believe that they have high blood pressure. They make excuses or say, oh, it's because of my job, or I'm stressed out at home, or it's just this, or it's just that. And it very well could be some of those things. But that's not, you know, the cause of it sometimes. Sometimes it's genetics. Sometimes, you know, you get those people, I work out 6 days, 7 days a week. I know, you know, I'm healthy.
Right.
Well, you may do that, your lungs may work, but your blood pressure and your heart not working, you know, as well as it should be.
Wow.
So then sometimes they have heart blockages that they don't even know that can cause the blood pressure. So then we're pulling out EKG machines because they honestly just don't know.
So let's stop right there. High blood pressure, because I mean, I think a myth too, and I'm guilty. You hear the numbers of African Americans have the highest in this, and they have the highest in that, and I'm thinking, we don't really have the highest in everything. But obviously, why is that? You said genetics, exercising.
Genetics and lifestyle. You know, sometimes we don't live that, our eating habits are bad.
And we're talking African Americans.
Yeah, I'm just talking,
keep it real.
Just African Americans, period. We like to eat. You know, we want to go to soul food. We want the greens with the salt pork and stuff in the greens. We want all the extra butter and all the extra this, you know, because it make it taste good. Because that's what we did back in the day.
Right.
But now, you know, as people get older, as things are changing, sometimes, you know, sometimes they'll make the foods as good as they used to as far as what they're putting in them. So we have to learn how to eat better. Overall, just exercise, just, you know, watching what we eat. Low sodium diets. Just don't add as much salt to your food, or don't add extra salt. There's, you know, DASH diets, Mrs. Dash, and I'm not getting paid to say this, but I love Decatur's Farmer Market. They have, they're out off ponds, and they have a wall of nothing but herbs and spices and different things that you can flavor your food,
and it's natural.
that's natural and that doesn't have the salt in it. And so that's what I actually incorporated in my own house, because I'm one who, you know, I have to take a blood pressure pill every day.
Right.
How can we encourage our family and friends to be proactive as health relates to health?
And so with that, what I would say is definitely preventative care. So make sure you're going to your doctor's appointments. Make sure you're doing all your recommended screenings at your different age groups and levels. Make sure you're keeping up on your colonoscopies, mammograms, you know, if you're of age, your pap smears. If you feel aches and pains or don't feel right, don't ignore them. You know, go talk to your healthcare provider just to make sure that nothing else is going on, because sometimes the subtlest things can be the things that be the biggest problem. So you don't want to just keep brushing things off if you don't have to. Right. I know a lot of times people say that their provider doesn't listen to them, or, you know, they don't want to go. So you have your family member saying, go to the doctor, and then they don't listen to me. So if they don't listen to you, find another doctor. You know, is the way I see it, because you need to have that provider, and just us as providers need to make sure that we're listening to our patients. Correct. So that we're providing the best care that we can.
That's right.
So instilling that trust.
Right, and it is unfortunate, you know, we do want, and I hear you, for individuals to make sure they have their health screening, you go to the doctor, and the reality is, unfortunately, what about those that do not have insurance?
And see, that's one of the big things too, and that's why I think that the access to health care should be increased. Yes. I mean, that's just one of the biggest things that we all suffer, and the prices are so expensive that a lot of people can't even afford it.
Exactly.
And so, and then you have a lot of places that offer self-care or self-pay, which, you know, sometimes they could get around that, but what if they don't have those funds? Right. You know, so then you need those places that are going to offer and kind of just take the back end and cut their losses and be like, hey, we need to be here for the patient, just take care of the patient.
Right.
If they don't have the money today, you know, especially if it's something that can't wait, I feel that that person should still be seen. I mean, that's just me. I don't run my own clinic, but,
I know, the reality,
you know,
of it
one
is,
day, hopefully I will.
You will.
But with that, it's just that access to health care is crazy.
Very critical.
The insurance part.
Yes. But without health care, still exercising,
still
exercising,
watching your diet. Still watching
whether
the
you're
diet.
Diagnosed with preventive, you don't want to get to the point where you are diagnosed with something. So
exactly.
And then studying your family.
Your family history is a big one. And they actually have genetic testing out now, where you can actually get tested for genetic cancers to see if you have like that link in your family. And I actually had it done. It was called a 53 gene. So it's screened for colon cancers, breast cancer, uterine cancers, like 53 different types of genes that could cause cancer in the body. And I'm actually negative 53 out of 53, so I was excited. So now if I develop any type of cancer, it'd be because of lifestyle.
Wow.
So it won't be because of genetics.
Is that a test that you request with your primary physician?
Yes, if they offer it. Some places offer it, some places don't. So you just kind of figure out who can, you know, who doesn't, and it's just all blood tests. And they'll send it off and it come back just like a normal lab.
Wow, that's awesome. So if there's one thing you could change, what would it be and why?
It would be, that was one of the things with the access to health care, especially in that. So one of the major things I would say, Georgia is very restrictive on how nurse practitioners practice.
Talk to us about it.
So we cannot do a lot of things that, of course, the MD does because we're not MDs. But there are things that they can allow us to do that we can provide better care for our patients.
Such as?
You know, sometimes we can't put x-rays in our names. They have to go in a doctor, or we can't order certain labs or certain things in our names that it's like, why not? You know, certain medications we can't prescribe. So then you have to tell the patient to come back, oh, let me, you know, only the MD can do that. Only the MD could do this. You know, there's so much that a nurse practitioner could do within their scope of practice because they train us to be able to do that. But it's like we got this leash. You know, we can't, we go a little, but they pull us back. You know, we go a little, but they pull us back. And it's like, if they allow us to practice at our full authority, we could see more patients, we can have stronger access to health care, we would be able to cover more ground than we do now. You know, and it's just so restrictive. Like, you have other states that you work in collaboration with, or you have some states where the nurse practitioner is on their own. You don't need a physician at all to consult. And granted, yes, because we're not at that level, you know, everybody needs some consulting every now and again. You know, you need a backup. So I'm not saying that we are just so that we don't need help. It's not that. It's just that if we were able to function at our full capacity of what we're taught to do, like, we can expand healthcare so much more.
So why do you, and I knew that there are a lot of other different restrictives in Georgia, but Councilman Davis and I are elected officials, so that is something that we can go back and talk to our state legislators, federal legislators.
Yeah, like, we've been fighting so long. Like, I'm a member of the UAPRN. I'm sorry if I apologize. I always say the letters backwards. But we talk about legislation and different little things of how we just don't have that full right. And it's a lot of nurse practitioners out there that want to do more, that can do more, but we can't because of state law.
Wow, I didn't know that
And
one.
could you speak a little bit about, no, it's probably out of your range, Obamacare?
Me personally, about Obamacare, when you go online and you Google, you know, and you go look at their health, it's still high. So I'm just like, how does it help us? You know, even with Medicaid, Medicare, like, they cover certain stuff, some stuff they don't cover. The out-of-pocket costs are still high for patients. You know, like, they'll come, like, I have insurance, but then the deductible on it is like $3,500 or $4,500. So then we order tests or order x-ray, and they're like, but I got a $500 bill for my x-ray because they say I haven't met this or met that. And I just don't think that's right. You know, that's not increasing access to health care. You know, it still needs to be affordable, even though it's called affordable. The Affordable Care Act is not affordable. You know, I was like, it's not affordable. And no offense to Obama, but I'm just like, it's still not affordable for people, and that's just not even African Americans. That's just for people
Across
in general.
the board. And I think just what you said earlier, that basically has nothing to do with President Obama, but it is the restrictions that are here in the state, just period.
Yeah,
There
like,
are so many restrictions. You could go to another state and see
have more
done.
care.
Yeah.
You know, look in Canada, they don't even pay for health care.
I hear you. I hear you.
Right, you said Canada?
You don't pay for health care. You pay for it in another setting, but
Yeah,
it's not like
it's done in a different way, but you don't pay.
it's a health care is a priority.
Yep.
In Canada. It is for us too, but the restrictions, and I feel you, that is something that needs to be dealt with.
Because there's a lot of people sometimes I would see in the office that hadn't been there for like a year or 2 years. And it's like, why haven't you been to your blood pressure? Well, I ran out of my meds and my insurance got cut off, so then I couldn't come because I didn't have insurance. And then it's like, we got to start all over again with care, getting that person back established, getting them back on track, getting them back, you know, to where they was before they didn't have the, you know, before they lost because they couldn't afford the insurance.
Wow.
I've spoken with a veteran about a week ago, and he was feeling bad. He had ran out his blood pressure medicine, and he hadn't been to the VA in about 2 weeks. He hadn't taken his blood pressure medicine. Is there any way that someone like that can come into an office and they give him temporary blood pressure medicine? Now,
see, with him being in the VA, and it's only been a 2-week time frame, and as long as he was regular, they could have just sent that medicine to the pharmacy. You know, their provider could have just gave them additional 3-month supply and say, hey, just make sure next time you follow up. I know that's what I do a lot. If they're regular and they come and they just get a little short, I'll just send in and say, hey, just make sure your next appointment needs to be in person. I need to see you. I need to evaluate you. Just come in as soon as you can. With that, if they're in the VA, some VA vets, they have other primary care as well. So they'll always have like that backup doctor, so then, or provider that they go to when the VA won't refill them, they'll come see us. Because I've had actual patients that did that too, where they would have 2 providers.
Come out of you. I wanted to hear that on our TV, so that way anyone, veteran or anyone that falls short, don't just take it upon yourself to sit at home.
Right.
Yep. No, do not sit at home. You know, you call them and say, hey, can you at least give me 30-day supply? I'll make an appointment and I'll come in, you know, but I need this medicine, because now in that 2 weeks, you've went from possibly controlled to now inching back towards the out of control.
That's
Now
right.
you got to get the
square one.
medicine back in to get back, you know, get the blood pressure back down. But yeah, and always, if their insurance allows them to have a backup provider, just have that backup provider. So in the event that that's, you know, happens, then they got somewhere that they can go.
This is really interesting. With healthcare, like in my family, hypertension, diabetes on both sides.
Diabetes is the other biggie.
Yes. So I have insurance and very grateful. And I want to say about a year ago, maybe a year and a half, my doctor said, you're a borderline diabetic. And it scared me because my...
Pre-diabetes?
Yes. So with that, I think I just took off, started going to the gym, eating healthier, and I saw a huge difference. In fact, I felt a lot better.
Yes,
a lot better.
Because you probably had elevated glucose levels that you didn't even know you had throughout the day.
How can you identify that?
So sometimes if it gets very high, you know, people will feel kind of like just off, a little lethargic. Sometimes they just feel, they don't feel good. A lot of them say, I just don't feel good. And the only way to truly know exactly is, of course, if you prick your finger and do a glucose. But some people can have 500 and they don't know.
What about in our children? With the eating habits I've seen more children and youth diagnosed with diabetes this day and time.
So then that's when you watch out. Usually they have increased thirst, increased hunger, and increased urination. So those are 3 signs that show that your glucose level may be a little out of control. Sometimes in the heavier children, if you look on the back of their necks, it's dark in color. So sometimes that will dictate if you have some type of insulin insufficiency or insulin issues kind of going. So you can kind of look at that and have them screened. Some pediatricians, and I'm not a pediatrician, but I do family practice, sometimes we'll do that in our overweight kids when I was working with kids, even if they're younger. You know, and we saw that we would do testing for diabetes and actually watch their blood pressure as well.
Wow. Wow.
And so, but the same rules apply to them. Watch what they're eating, exercising, not sitting in front of those video games all day, you know. Get them out, get them active, get them doing something.
And their annual checkups.
Yep, make sure you keep your well child checks and things like that. And if there's any concerns, make sure they voice it with the pediatrician. You know, whether it may seem some little could mean something big. So.
Right. It's interesting.
Interesting. I have one more question. And how are you all coping and handling with COVID and Omicron?
Handling
COVID and Omicron.
Yes.
So
tenderly.
Yeah, because I guarantee the past week I've had so many televisits with patients who either have COVID symptoms or anything like that. So we just kind of go through, let them know that it's going to be okay. You know, first just kind of calm them down, let them know it's okay. Make sure that they get tested just to confirm that it is COVID. And then once you do that, make sure they're quarantining, make sure they're wearing their masks, make sure they're staying away from other people. A lot of people will say, well, this when they come over, you know, they want to hug on. No, keep your distance, stay at home, you know. Have friends and family come over, help bring food and drop it at the door, you know. So just a lot of education of things that they, because a lot of them get scared because they think they're going to die. And we had my 10-year-old, like we had it, Omicron, and the family, it doesn't matter if you're vaccinated, unvaccinated, it's getting everybody. And my 10-year-old, when I told him, okay, you got 10 days, this is before they switched to the 5-day, I said, you got 10 days, he bust out in tears. And I'm like, what's wrong with you? He was like, I'm gonna die in 10 days. So he thought that I meant in 10 days it's over. And I'm like, no, son, no, that's not what I meant. You know, you just have to stay away from people just so you can get better. And then when you're better, you could tell everybody you kick COVID's butt. You know, and so he was excited, you know, with that. But just making sure that people, you know, wear your mask, you know, just avoid places of, you know, big crowds if you don't have to, you know, and I'm talking vaccinated, unvaccinated, because and I won't talk to
Right,
that
right,
either
right.
way, because
Sure, sure.
everybody has their own belief of what they
Correct.
believe in as far as that goes.
Right.
But still just, you know, protecting yourself, washing your hands, making sure that if you do have those symptoms, staying at home, staying away from people, get COVID tested just to make sure that you don't have it. A lot of people now, we're telling them do Mucinex, make sure they do their vitamin D, their vitamin C, their zinc.
Right.
That's helping a lot of people heal with that. A lot of healthcare providers, some are, some aren't, are actually prescribing azithromycin to kind of help with that antibiotic, to just to kind of help do that. We do Tessalon pearls and stuff for cough if, you know, they have that. But if it gets to the point to where it's after that time period and they just feel like they're not getting any better, then, you know, hey, ER, if you feel short of breath at any time, ER to where,
Right.
that way, because you might have pneumonia, COVID pneumonia. So, and there's no way to know that unless you get it, you know, go to the
X-ray.
hospital and get your chest x-ray.
Right.
So it's just different little things like that, just being aware, just that awareness.
Right. Well, you know, we so appreciate what you do, along with all of our other doctors and first responders. I can't even imagine just the level of stress and overtime. And you said that you've seen time after time just on telecalls how many individuals have been diagnosed with COVID or Omicron. But we just want to say thank you. Thank you for
you.
taking time out of your
Welcome.
busy schedule
You are very welcome.
Thank
to
you.
interview with us. And this is just amazing, just the information that you've given us in regards to preventive health, making sure that we look for those entities, the eating healthier, exercising. Yes. It doesn't matter if you're heavy or tiny, you can still have
That is correct.
A decrease in health.
That is correct.
So wasn't this awesome?
Yes, thank you. And I'm waiting on that book. You have a book yet?
My cousin, I have a story, man. Like, I have a full testimony. I have a cousin that tells me all the time I need to write.
Okay.
And so right now I'm actually working on my brand, so Impulse.
And what does that mean?
So with Impulse, for me, I started this brand because a lot of healthcare professionals do not get the respect that they deserve in the workplace.
Okay.
You get some people that are in the higher up positions that treat people in the lower positions as if their position doesn't matter.
And this has nothing to do with race. We're just talking about
this is in general.
Okay.
And so I've been through a lot and I've seen a lot. And I just found that it doesn't matter what position you're in, a lot of people don't respect that position. So it doesn't matter if you're a CNA, it doesn't matter if you're an MA, it doesn't matter if you're a, you know, care coordinator, RN, LPN, whatever, physician, pharmacist, you know, pharmacy tech, whatever it is. Everybody deserves respect in the workplace, no matter of your job role. And so my brand is actually working on bringing other like-minded individuals together in one community that we serve. And so my slogan is one heart, one pulse, one beat, because we're all one person. And we all, we're all one person. So we all work together for the better of the patient, regardless of what role we play.
That's awesome. So whatever we can do to help one voice, let us do that.
And since this is Black History Month, and I know this may be off the record a little bit, doing as an Afro-American, you ever see any discrimination, any?
You get that a lot.
As female, African-American female, and in the position you're in.
You get it a lot. I actually used to get it a lot from the patients, more so than the actual healthcare workers.
Is it because they didn't believe? Why do you think that?
One, they were older, so most of them were older, so they were still set in their ways of thinking from then. I had one guy come. I went in for a patient. His family was in there, and he was like, "Yeah, the old colored girl." I just kind of looked like, "Colored girl," and so I'm one of those. I don't take offense. Very, you know, like I've learned to not react to certain things. And so when he said that, I just like, "Color girl, really?" You know, and so his family was there and they were like, "Oh, we don't say that. We don't say that." He's looking like, "What?"
And I told him the color purple.
Yeah.
Well, that's what he knew.
That's what he knew. And I told her, I said, he doesn't know that we don't say that. And I said, "Sir, it's okay to say black. It's okay to say African American. You could say that, or you could just call me by my name. It's okay to do that too. Right. You know, you don't have to distinguish between color." And so he just kind of looked at me. But you get that quite a bit. As far as companies, most of the people have been diverse. So I haven't had that type of racism within the, from coworkers, but a lot more from patients.
And maybe too, because if you're older, sometimes as beautiful and young, an older person may say, she doesn't know what she's talking about.
I get a lot of people like, how old are you? You're a kid. I'm like, I'm actually older than what you think. And so they go through and they, like you said, they'll think, how are you going to take care of me? You know?
Right.
And so, but when I go in there and I start doing my thing, then they're like requesting me and want me to come back. Like, no, I want her, you know? So I go in and just try to do what I can do to the utmost that I can do.
Well, this has been amazing, and we're going to have to invite you back again, but we don't want to let this time be the last time that we talk about health care, specifically for African Americans, since we are doing our continuing moments, but for all individuals to make sure that your health care is number one. Take care of you first.
Yes.
Yes.
And then if anybody wants to reach out to me, I mean, it's at Impulse.
Okay, so that's actually online.
This is on Instagram.
Oh, wow,
and so Impulse 3 is the Instagram. And then I have another Instagram called Doc Bree NP.
Okay, so let's say that slowly, because we want our listening viewers to hear where they can find information. And if they go online or Instagram, what will they find?
So they can put in Impulse 3, and so they'll find my logo like this. That page is still up and coming, but I actually start to plan posting people on for Black History Month.
Wow.
So I was kind of keeping it close for that. And so if they want to reach out to me there, they can. Just in DM is fine. And then the Doc Bree NP, that's my professional page.
Okay.
And then you can also do support at shopimpulse.com, because eventually I'm going to sell the shirts and everything, because as they wear these shirts, they're representing a community. So it's not just representing just the brand, but it's representing the community that we're trying to
all right, well, we've got
build.
you. Right, Councilman Davis, got you, Doc.
Yes, thanks.
Appreciate it.
Thank you.
Come on over here.
Well, thank you so much to our
Thank
viewing
you for having
audience.
me.
To our listening audience, we are so appreciative today for Dr. McCoy to join us with Continuing Moments with Councilman Samuel Davis, and I am Councilwoman Dr. LaShawn Burr-Danley with the City of Douglasville. Happy Black History Month, and we have enjoyed this segment of our show. Thank you.
So exciting.
Thank you guys for having me.
And we'll see you in a moment.
All right. Thank you.
Thank you.